So in the old days, there was an issue with bone. We used to have patients come to us and say, doctor, I was told I don't have enough bone. I'm going to need bone grafting, or I'm not a good candidate for implants. That could be the case because maybe it could be the experience level of the clinics, maybe the imaging was not up to par. But when patients come to our office, we're able to take a scan, and our scan tell us an accurate representation if they have good bone or if they don't have good bone. And most patients will not leave my office with some sort of an option with implants.
Who is the typical implant patient that you see?
So Randy, a typical implant patient that comes see us is that are headed for dentures. People that have basically failing teeth, decayed teeth, they are in pain, their teeth they can't smile, they can't chew. Their self-esteem is impacted. They're hiding their smile when they talk to their friends and family, but they're in constant pain and agony because they don't think they have any hope available. Because they've been told that they're not a good candidate. That's one. And majority of these patients have been told that they're not a good candidate for implants. They can only have dentures. But when they come to us, when they meet me and I go over the options, they can actually have implants in teeth literally a week after. The second group is the denture wearers. They've been wearing dentures for 10, 15, 20 years, and they're done. They think they're done. They have their dentures in the mouth, they're done. But that's the farthest from the truth. This is where they suffer. They suffer because they can't taste their food. The upper denture holds up there. It opens up, it actually closes the palate. So you can't taste your food. When they're talking with their friends and family, or they're playing with their grandkids, the denture falls out. So it's an embarrassment. And most importantly, they're rapidly losing jawbone. So they're constantly, their mouth just continues to shrink. But
their face sinks in.
Absolutely. Their face sinks in because the bone is shrinking. And a lot of them, they don't know because nobody tells them that the longer and longer they stay with dentures, they're going to continue to lose bone and their face is going to continue to shrink. And then they feel that they have no options. So especially with the denture wearers, we can help them. We can help them immediately. As minimal as 4 implants per jaw, they can have full set of fixed teeth, permanent teeth that don't come out. And
you say it's hard to get the denture wearers to come in. Why?
The reason why, Randy, is because they feel that there's no need. They feel that once they have their denture, their dental problems are gone. But now it starts a new series of problems. Bone loss, face loss. They can't chew their food. They can barely chew their food. And they're literally like mushing their foods and swallowing. And then a lot of these patients have a lot of stomach problems. They have a lot of other health issues because they can't eat their foods properly.
Most of these people are sedated, right? You say they barely even remember the procedure.
They do. They barely remember any part of the procedure because they're completely under general anesthesia or they're sedated. And that's the best part because a lot of these patients are fearful. Fear is what held these people back from getting the ideal care in the mouth.
You say that a lot of because I asked you in the green room and you said the number one thing holding them back is they're afraid. It's like a hassle.
Right.
Is that what they tell you?
That's the number one reason why people put it off is because they've had their fear. Well, what if the fear came from? Fear came from either an early childhood, they had traumatic experience, or into their adolescence, they've had a really negative experience at the dental office in their traditional dentistry, whether it's drilling, fillings, crowns, and root canals, and they've had really, really negative experiences. So they're tired. They give it up. And then they're like, once they give up, neglect took over, and now everything is just falling apart. And these are the people that come to us. So then we're giving them hope. We're giving them a smile. We're literally doing it in a shorter period of time and doing it in one office, one team, one doctor, which makes the experience go much efficient for our patients.
Now, what if you have like gum disease? The bad gums. Can you still get implants?
Absolutely. These are about, say, it's 50 to 60% of the patients I treat, Randy. There's a lot of our patients come in, they have advanced gum disease. Their teeth are loose. Their teeth are hurting. They've already gone through a lot of gum surgeries and have already gone through traditional cleanings. We're at the point of no return. We're at the end of the road. So now what we're going to do, either just not do anything, or they're going to have dentures, but they don't want dentures. They want teeth. They want teeth that they can eat, they can chew, they can smile, they can bite into nuts, they can bite into corn on the cob, and not have to worry about it. And hassle-free. That's what they want. They want hassle-free. They want to be able to get up in the morning, brush, and go to work, enjoy their time.
Not even think about it.
Yeah, not even think about it. And that's what patients want. So, Randy, when you take out the bad teeth, the gums and the bone gets very, very healthy.
Okay.
It eliminates the infection. And the infection is what causes an inflammatory response that causes a bad immunity. So once the bad teeth are out, their immune system heals, and they have healthy teeth, and not only healthy teeth, they have healthy gums, they have healthy bone. That's when we place the implants. This is the day the teeth come out,
okay,
and then they can leave with fixed teeth.
We have medical doctors on this show, and one famous medical doctor from Los Angeles, that part of his protocol for getting healthy is you got to make sure that if you have a bacterial infection in your mouth, you got to get rid of it.
Absolutely. It is
So this has
important.
become mainstream now.
It has absolutely become mainstream. I will add something to it. I have a lot of patients right now that are getting hip and knee replaced this time of the year. And
Hip and knee replacement.
Hip and knee replaced this time of the year. And a lot of them are coming and getting their teeth done because they have they have broken teeth, they have damaged teeth, they have unhealthy gum tissue, but with the gum disease, their doctors want them to be taken care of before they have their hip and knee surgeries done.
How old can you be to get this done? Like, what's your oldest patient that you've given a brand new set of teeth supported by implants?
Randy, age has never been a barrier in our office. My oldest patient is 92 years old.
Why would a 92-year-old want to do this?
Well, Randy, 92-year-old is there's never an age in our office for the barrier, but everything revolves around food. Every day, a
92, if you're that age, yeah.
92-year-old, just like another 25-year-old, they want to eat their foods. They don't want to live with bad teeth. They don't want to leave with dentures. They don't want to have ill-fitting partials of dentures and broken teeth. They want teeth that stay in their mouth, that look good, feel good, and it's going to last them a long time.
So with this 92-year-old that you did, how did it go?
It went phenomenally well.
Were you a little nervous during this?
Yeah, it's always good to be a little nervous because then you're doing it. You're putting your care and attention to every patient.
Okay.
But when the patient was done, the patient was so happy. Not only she was happy, her family was happy. She comes from a family of healthcare providers, and they were very happy that we were able to help the mother.
So when a 92-year-old can do it, like 80's young,
absolutely,
like no problem for it. Did you ever have patients go, Doc, am I too old?
Patients think that way, that they might be. The people in their 60s and 70s and 80s think that they're too old. But if they're healthy enough, they have enough bone, they're a very good candidate.
So in the dental literature or whatever you guys have, I mean, is the data there that it doesn't matter how old you are?
There is no data that says that you can get implants when you're 70, 80, or 90 years old. You have good bone, you have good medical history. If you are a good medical candidate, absolutely you are a good candidate for implants.